In this video, I'm going to share with you 8 tips to help you squat pain-free and avoid a low back injury. Hey, what's up YouTube? It's Coach Remi here. I get questions all the time about squatting and low back pain. And other than the deadlift, the squat is perhaps the second most common exercise that people perform incorrectly and throw their low back out from. Squat is a great topic to cover, and I'm excited to dive into this video and share with you 8 common technical and programming flaws that I see with new low back pain clients. And this video should also give you a bit of insight into my squat assessment process. Now, before we jump into this video, just a quick disclaimer: back pain is caused by a multitude of factors, and it's always best to visit a medical professional to rule out any sinister causes. Not everyone is ready to squat right away, and they may need to wind down their symptoms first before they can perform the motion of a squat pain-free. Other than that, let's jump into today's video. Let's go. For tip number 1, you need to understand what the cause of your back pain is and what triggers it. So how does posture, motions, and load affect your back pain? So for example, someone with flexion-based back pain typically has pain with rounding their back, with prolonged sitting. Someone with extension-based back pain would have pain with lumbar extension. And then someone that has pain with load, maybe just holding a heavy object triggers their pain, or if they jump up and down, that triggers their pain. Whatever the cause is, it's important to understand, because as we move through the next 7 tips, understanding what triggers your back pain could give you some insight into maybe what caused your back pain or back injury to begin with if you were performing a squat incorrectly. So once you understand what triggers your back pain, you can then move into the next tip, which is tip number 2, butt wink. So butt wink is a common squat error, and perhaps one of the most common squat errors I see people make. And what it involves is engaging in rounding of the back towards the bottom of the squat. So not everyone is designed to squat all the way down. Their genetics and their hip structure just doesn't allow them to safely. The key thing to understand is we need to play around with a person's stance and find what is optimal for them. So for example, if I go close with my feet, you'll notice my back will round sooner. Now, if I go wide with my feet, almost in a modified sumo stance, and I squat down, I can get deeper and still maintain a good neutral back position. So why you want to avoid butt wink is because if you engage in that over time and as we apply load, that can create a flexion-based problem or trigger flexion-based symptoms in somebody that already has back pain. So the key thing is find what squat stance is suited for you and your anatomy and allows you to get as deep as you can safely without engaging in that butt wink towards the bottom. So that's tip number 2, is butt wink, and look out for that. Tip number 3 is hip shift. Now, this is another common squat error that I see. And if you observe someone squatting, sometimes what you'll see is when they squat down, they'll shift to one side. Now, the reason they do this, it could be because of a motor pattern that has developed. Just using my experience with basketball players, they commonly do this. So if you look at the basketball shot, it involves a partial squat, and then as they release the ball, they're shifting kind of to one side, and they're repeating that over and over again. Now, that motor pattern gets ingrained into their brain, and then what you'll see is they come into the weight room, and they'll start squatting like that to one side, but with weight now. So why that's problematic is because that could lead to imbalances developing and some instability and perhaps an SI joint problem developing. So how to fix this? Well, we have to understand why it's occurring. Is it a motor issue? So if it's a motor issue where they're just shifting like that, like a basketball player, typically just cueing them to square up fixes the problem. Sometimes it's a stance issue, feet are too close together, or sometimes it's a mobility issue. They're lacking maybe internal rotation on one side of their hip. Maybe we've got to do some mobility drills, some foam rolling, or maybe some manual therapy to correct that and to allow them to squat safely without a hip shift. So that's tip number 3, look out for the hip shift. Now tip number 4 is hyperextension. I wouldn't say this is as common, but it does happen. So when people squat down, as they pop up, they may finish in hyperextension. Now, when you factor in a heavy load, and you do this over time, you're really cranking on the facet joints as you go to that end range extension. And for someone with extension-based issues, that can flare something up right away. or someone without any back issues, it's really going to crank on the facet joints and perhaps create maybe a stress fracture or some arthritic conditions down the line if they continuously do that. So that's tip number 4, avoid hyperextension. And really just to avoid that, just be aware that you're hyperextending and limit that range. And also sometimes just a simple glute squeeze at the top will clean that up in some people. So that's tip number 4. Now, moving to tip number 5, which is core stiffness or lack of it or a lack of brace. So, remember my core stiffness is, if I take my elbow for example, and I flex my arm here as hard as I can, I can't move my elbow. Now as I relax it, move up and down, there's motion. So when people squat, we need to make sure that they're tailoring the brace to the load that they're lifting. So when I'm getting people squatting heavy, I want to make sure that their core is nice and braced and I can't move them, especially when they're squatting heavy. Now for someone that's squatting very light, they don't need that same brace. They can squat up and down without that same brace. Now, if they do keep a strong brace like that when they're doing a bodyweight squat, that actually can be detrimental to them because their bracing is unnecessary for that amount of weight that they're moving, just body weight. But for someone that's lifting very heavy, we want to keep that strong brace. Now the reason being is because if we don't keep that brace, that's going to shift a lot of the force to our passive restraints to stabilize, such as our ligaments, discs, and joints, which we don't want. And over time, there's some issues there that can create maybe a painful micro movement in someone's back, and then you can get a sharp pain if they're squatting heavy and don't have a proper brace. So that's tip number 5. Now, tip number 6 is load placement. When we talk about load placement, just going to use the barbell here, for example. We could have the load placed in the front, like a front squat, or on the back, like a back squat here, or the load can be placed overhead, or we could have the load placed in an offset position where it's specific to one side. Now, each of these is going to place load differently, or is going to load our tissues differently. So overhead squat is going to be very challenging on somebody because someone needs to have good adequate anterior core control because they have to really resist hyperextension. An offset squat, that's going to pull somebody down in deflection and a little bit of rotation, so they really need to resist that pull. Front squat, anterior loaded, back squat, posterior. So why this is important is because if someone has back issues, maybe it's specific to one side, the biomechanics are going to change, and some of these placements aren't going to feel too good on somebody that has existing back pain. So the key is you want to find which load placement feels best for you and you can tolerate and perform pain-free. So that's tip number 6 for you guys, is load placement and understanding that different load placements is going to affect the biomechanics and maybe trigger your back pain. So that's tip number 6. Tip number 7 is stance. Now when we talk about stance, we already talked about this a little bit with regards to the butt wink, but when someone's squatting, the way I like to cue somebody is make sure that they're gripping the floor, rotating their hips outwards, and their toes are really kind of squeezing and gripping in. They're kind of becoming one with the floor. Now, by rotating kind of the feet outwards, that engages the hips a little bit, and that can take back pain away from people and allow them to perform a squat up and down pain-free. Another thing we have to understand is a split stance. So this position here, up and down, with the pelvis rotated forward on one side, backwards on the other side, that could either be pain-free for somebody or actually provoke pain, specifically someone that has an SI joint issue. Because if they're programming too many split squats or lunges, and as they add load, and they're doing an excessive amount, that can create some laxity at the SI joint and cause a problem. So you have to be very careful with how you're programming and the stance that you're using. So that leads me into our final tip. Tip number 8 is programming. How are we thinking about programming the squat for somebody? What is the goal? What are the intentions? So what I mean by that is, what is the load we're using? Reps, sets, rest. What exercise maybe we be pairing it with? Are we pairing the squat with burpees or maybe a dead bug? Is the dead bug, I would say, complements squat way better than a burpee does. Burpees inducing fatigue. If someone is lifting a lot of weight over time, if they're going back and forth, technique could break down and an injury can happen. So we have to understand programming, because if we don't program accordingly, that can create a back issue if we're not smart and strategic in how we program squat for somebody with back issues. And that's a wrap. I hope you guys enjoyed this video and that these 8 tips help you perform the best squat possible, back pain free. Let me know in the comment section below which tip you found most helpful. Was it butt wink, hip shift, or one of the other 6 tips? Let me know below. And if you're new to this channel and you want to see more back pain tips, be sure to hit that subscribe button. Okay guys, I wish you all the best. Have a successful and productive day, and take care.